Welcome to Grand Rounds, where we speak to global thought leaders in healthcare innovation. This series is brought to you by the Physician Innovator Network, and we are your hosts, Sunny Johal and Chance Park. Thank you for joining us here, Dr. Grossmann. The Physician Innovator community is very excited to have you on, and I want to give you a warm welcome here.
Thank you very much, Sunny. It's a pleasure, really an honor to be able to have the opportunity and chat and share some insight with you.
Absolutely. So I'm just going to give a quick introduction to Dr. Grossmann. So Dr. Rafael Grossmann is a full-time practicing general and trauma surgeon in Maine, USA. He is an alumnus and faculty at Singularity University. He is a global speaker, healthcare and education technologist, and futurist. On June 20th, 2013, Dr. Rafael Grossmann was the first physician to ever use Google Glass during live surgery. He is currently focusing on spatial computing, MagicLeap, and Hololens applications in healthcare and education. Dr. Grossmann is a longtime advocate of telemedicine and digital health and believes in the power of technology to augment healthcare and education. Welcome again, Dr. Grossmann.
My pleasure. Thank you.
Without further ado, we're going to go to a presentation from Dr. Grossmann here, and then we'll be back for some question and answer period.
Excellent.
There must be an industrial revolution in education, in which educational science and the ingenuity of educational technology combine to modernize the grossly inefficient and clumsy procedures of conventional education. Sydney L. Pressey, 1924.
We have come a long way. It's been an evolution, I would say a revolution in the last several decades. From computers that fill up a large room and had very little power, to computers that fit in our rings, in our watches, in our blade, smart glasses, in our phones, in our pockets. This is an early prototype of a VR headset. Imagine how far we has gone from there to here. It's really been a phenomenal advancement. When we think about technology, we have to talk about Amara's law. We tend to overestimate technologies in the short run and underestimate them in the long run because we think linearly and technology develops exponentially. Our minds cannot cope with them. So you have technologies like AI or autonomous vehicles or VR, which are initially very overhyped, overestimated, and in the long run, they are going to be taken for granted, like GPS, for example, is today. No one thinks about GPS, but it runs the world, right? So it's really been pretty interesting. As a surgeon, as an educator, we deal with technology every day. And I always think it's about not the technology, but about the smart use of the technology to improve what we do as healthcare providers, as educators. If you think about how a surgery was taught hundreds of years ago, the operating theater is the same today, the same operating theater with fewer people trying to look behind us. And when I used Google Glass for the first operation in history, that was the point. It tried to enhance, augment learning. And the tools that we use in the OR today are tools that we never thought possible or before, or never imagined before. Digital technologies are all around us, in and outside of the OR, or outside the hospital. If you think about science fiction, the best predictors of the future are the science fiction producers. Real Player One only came out about a year and a half ago, and we have the tools today to make it real. If you think about pilots, how they train before they fly a plane full of people. If you think about technologies like Engage VR, immersive education, they had a rendering exact rendering of the anatomy lab in Stanford, and students from all over the place with their headsets, wherever they were joining this digital virtual room and learning anatomy as if they were there. Technologies like Vario headset, which allow you to enhance that learning process, right? You can dissect a cadaver, anatomically and physiologically correct, without the ethical or philosophical or economical factors involved in a cadaver lab, in an anatomy lab, right? So there are many platforms out there. If you think about medical education today compared to a few decades ago, we have a long way to go, but we have made a lot of advancements. Animaris, visualization, interactive AR technology that allows you to learn anatomically and physiologically correct details. This is a rendering I did in my operating room with the Animaris inside heart through the MagicLeap device, and I tell you, it's just fun, but at the same time it's important to learn. If you think about XR, this is using the Hololens 2, the Holo patient, the Holo human on the COVID-19 proof of concept that they had. And you can take a student from the early phases of signs and symptoms of disease using photovolumetric patients, right? Renderings of patients, not avatars, not digitally created, but a real human. And you can take the student through the different phases, the natural history of the disease, so that the student learns better. But think about, the student can be anywhere with a headset, right? So in these days of pandemic, imagine how important that is. Also, VR has proven it, right? In many places in the US right now, they use the platform to learn better surgery, to simulate, to train before you get to the actual human patients, to make you an expert before you even touch flesh. So that is really, really an amazing revolution as well. And if you think of other platforms like Fundamental VR, for example, where they have the possibility of many students in the same room learning, but at the same time they're adding the haptic component. I think haptics are really, really important, because when you immerse yourself completely, when you have the touch, when you have all your senses engaged, you can really, really learn better, I think, despite some of the studies out there that do not support that. I think that even OVR, which is a technology, you put a chip in your headset and you can smell, you can feel the complete experience by smelling. The Sense Glove that you see there, I tried this a couple of years ago in Delft. The Sense Glove people had a platform similar to the one you saw before, but you can use this device to feel the different textures, to feel the densities of the tissue, to grab the drill in this case and go through the different densities of tissue. So this is using technology in a smart way in order to learn better. I think it's really exciting, because you know how you learn surgery or medicine today is very different, and it will be even more different than when I learned medicine, you know, in the 80s and 90s. If you at the same time, okay, additionally, you add the sensing of physiologic variables. iMotions did this, and I helped them with a Vario headset. We were doing two different simulations in surgery. You had an expert and you had a novice, and you measure heart rate, temperature, EKG, blood pressure, and GSR, galvanic skin resistances, and you can see that the expert was more calm while the student was not. And if you can get the student to be calm and to learn and to embrace the learning, the performance is going to be better. Think about robotic surgery, how much we have advanced in the last few years. Well, not much. Now there's an explosion of other platforms other than Intuitive and the Da Vinci platform, right? This is a CMR versus platform, and it's going to be part of surgery, and surgery, robotically assisted surgery, is going to really be a true revolution in the making. And if you think, how do we integrate virtual reality or distance, you know, a technology with robotic surgery, you can learn, you can teach, but also you can drive the device. You know, this is a proof of concept from a couple of years ago. You have a headset, and with gestures, you are driving the robot wirelessly at a distance. So imagine the potential. You put the headset and you're driving a robot anywhere in the world. You know, it's been proven. This is Atul Gupta with Microsoft and Philips, using HoloLens 2, using spatial computing in the interventional cardiology suite or in the OR. You are having all the data, all the digital images that you need to treat a particular patient in front of you. That technology is making you, you know, more directly connected with the patient. because you don't have to, turn around. Medivis has also designed platforms, the surgical AR, a platform to not only learn and diagnose, but maybe even treat patients with VR, with AR. You have actually renderings of tomographies in this case, right? And the renderings are not in 3 axes, but in any axis you want to give it based on your approach to it. So imagine using that to make surgery better, to make surgery more exact, to make surgery more efficient. I think we are getting there. We are getting there, and it's going to be a very, very exciting next 10 to 20 years. BrainLab, a well-known surgical navigation platform all over the world. They paired and connected with the mighty MagicLeap, and using their mixed reality viewer, you can enhance the interaction between the surgeon and the data. But it could be the patient and the data, the patient understanding the surgery better, the patient giving a real informed consent, for example, by using these digital tools, headsets like MagicLeap, but also the surgeon learning the road, the map, the trail that we are going to take better before we embark in doing the particular surgery. Learning that anatomy, interacting with it, it's just it's something that we've never been able to do this well before. MagicLeap is probably going to become, like any other XR headset, a real tool, real use in the operating room. This is the Hololens from Japan, a group of surgeons in a proof of concept video, but using the MagicLeap device to enhance how they interact with the digital images and how to, plan or guide their surgery before surgery or even during surgery. So I think that is really exciting, because it tells you that this is really happening. This is not really just the potential or something that it will happen in the future. If you add artificial intelligence or machine learning algorithms, this is touch surgery. Digital surgery is a platform to step by step. The AI algorithm is actually catching all the data during a laparoscopic surgery, and then it guides you through the surgery. It will make the surgery safer. It'll improve the outcomes of the surgery by guiding the surgeon, by having learned from the past mistakes. So this is where we are going. And there's so many technologies out there. If you think about telecommunications, about teleconnectivity, telehealth, remote connectivity, telepresence. This is a Aetho's Beam platform where you have an avatar, okay, or more connected in the same digital room through a headset device. In this case was the MagicLeap, and you bring people to your operating room, for example, and you interact, you do a teleconsultation. You have an expert guide you through a surgery or discuss a particular topic. And the important thing is that you can interact with the digital data, not just give instructions, but interact with, let's say, a 3D image of a liver, for example, that you're going to operate on. And so this is really, really exciting. And if you add then the amazing possibilities in cellular connectivity, where you have 5G coming very quickly. This is about a year and a half ago in China. They did a robotic surgery at a very long distance, thousands of kilometers, and they did it not over a wire, over the internet, but over 5G connectivity. It's amazing where we are going. And instead of these headset devices that we have today, maybe in the next 10 years or so, we'll have actual a hydrogel contact lenses. This is InWith, which has the patent to embed circuitry in these hydrogel lenses, the same ones that we use for reading, a contact lens. Imagine the possibilities there, where you can have augmented or mixed reality in a headset like that. So I'll leave you with this clip, okay? And you can decide whether you take the blue pill or the red pill. If you take the blue pill, you stay where you are. But if you take the red pill, then we can take you and show you where and how deep the rabbit hole goes. So thank you very much for this opportunity. And again, it's not about the technology, it's about the smart use of the technology. And think that paradoxically, but really paradoxically, technology does not separate us from the patients. Technology, in a way, actually makes us more connected to the patient. Technology can humanize the way we do medicine and the way we do surgery. Thank you very much.
That was a great presentation, Dr. Grossmann. So we really appreciate your insights. We want to now just go into some questions, and this was, created by our physician innovator team. And the first question is, you were the first to perform a surgery using Google Glass. How did this opportunity come your way, and what inspired you to do this?
Well, I've always loved technology, right? As a surgeon, obviously trained in the 90s in Ann Arbor, Michigan. That's when minimally invasive surgery was really taking some strides to become the standard, along with technologies like telemedicine, right, to connect us and help us communicate better. And I always thought that the technology should be used in a smarter, in a better manner to improve on what we do and how we teach medicine as well. And I had the opportunity to do a pilot program using an iPod Touch device for trauma telemedicine emergency consultations here in Maine. This is around 2010, 2011, when the iPhone 4 came out with FaceTime. And we had a pretty successful trial, and that was actually the topic of my first TEDx talk. And when I saw really the power of being a communicator, I started looking for opportunities, and I found a program called Future Med, which is now called Exponential Medicine, which is sort of the healthcare branch of this a bigger group called Singularity University. So I explored that, and I joined that training program. And one of the incredible speakers that I saw there was Babak Parvis, who was one of the inventors of Google Glass. And when I saw what Google Glass could do, to basically, with a little device, you can just have a connection to the internet. You could take a picture, record a video, live stream, have access to the internet. I thought, wow, this device is really something that could revolutionize again how we connect and how we communicate. So a few weeks later, I got one of these devices as a Google Glass Explorer, and I had the opportunity to stream a simple surgery, a simple procedure to a group of students situated, in the next door room. So rather than the students having to be, behind me trying to see what I was doing, they were just sitting in there, sipping their coffee and talking to me and answering questions. So it was sort of a very intuitive way to improve their learning experience and my teaching experience, looking at the operation from my perspective and connected with me virtually as if they were there in real life. So that was really a moment of, I think of sort of I don't want to say enlightenment, but when the device was really being advertised as an entertainment tool, for taking pictures of cats or music videos or whatnot, and if you could really improve how someone learns and potentially in a telemedicine consultation, maybe saving someone's lives or improving on medical errors, or so many possibilities with using the technology in a smart way. So that's sort of what started me as an evangelist of how exponential tech can really help us do better medicine and also connect us better in a much empathetic way with our patients.
Amazing. That's very inspirational. And speaking of your time, you mentioned Singularity University, and you are an alumnus and faculty, as I mentioned there. What else have you learned during your time there, and how has it changed your outlook on the healthcare system?
Well, exponential medicine, which is again the healthcare branch of Singularity, is really a pretty amazing sort of platform. Now they used to have this course for 7 days. It's called Future Med. Now it's called Exponential Medicine, and it's more a conference. It's a 3 to 4 day conference in San Diego every year, where anyone who has any sort of wild dreams or expectations or curious about technology and medicine convergence go there. So you see meet incredible people, incredible thinkers, incredible platforms, startups, attendees, and having access to that sort of a crowdsourcing, it really changes the outlook of I guess it makes you more hopeful, to see that so many people out there is thinking about how to use technology, and not just simple technologies, but technologies that are sometimes beyond our wildest dreams, in order to improve how people live here on Earth. That's sort of the broader thought of Singularity University. Improve the life of billions of people through thinking differently. And in exponential medicine, having initially being an alumnus there, and now being faculty for a few years, it really is a great experience, because you get to learn so much, you get to connect so much, you get to share your insights, and maybe to put a little bit of a little grain, of sand, in order to improve how people around the world can access healthcare, can teach healthcare, how to improve, global health access, and sort of equalize the field a little bit. So that's been sort of my experience.
Great. Yeah, it sounds like the exponential medicine track provides some great opportunities for those that want to make a real disruptive change in healthcare.
Absolutely, absolutely.
And as a healthcare futurist yourself, what are you've spoken about some of your areas of interest. What are 2 to 3 domains that you think people or physicians or healthcare workers should especially be focused on to make an exponential impact? Are there any domains that you feel deserve extra attention?
Yeah, I think that there's so much happening really so quickly that it's hard to grasp the amount of information out there. But I think that in general, if I had to choose 3, I think that immersive technologies, to connect and communicate better in every aspect of human endeavor. When I say immersive technology, I mean virtual reality, I mean augmented reality, and mixed reality, right? Those are 3 are really already exploding in every industry, but especially in healthcare and in medical education. But not just education, because it's education, diagnostics, and even therapy, even treatments, with virtual reality. That is really, really growing, but exponentially. And you see companies like precision OS, or you see companies like Fundamental VR, which is using the power of virtual reality and the connectivity to multiple people, and also while you are in that, have a haptic feeling to learn how to do a procedure better. All those things are you see companies like Gig XR or XR Health that are really empowering the user and how the user connects with digital environments to improve whatever, in this case, healthcare and education. The second one, I think, would be certainly artificial intelligence. I think that we've had artificial intelligence around for decades, right? But now it's pretty much in everything you hear or you see, there's AI somewhere, and it's true. It's just becoming more and more powerful, and it's becoming more evident. And now we're sort of, in a way, untapping that potential for healthcare and for education. I think that what we're going to see very soon is just going to be immensely important, because I think the AI is going to liberate us, the human providers, from all those really minor tasks that are mechanical and technical, almost like a hard skills, that the computers can do and the algorithms can do, machine learning, robotic assisted protocols and AI much better than us. But then the soft skills are going to be up to us, and we're going to grow up on how we do the soft skills, the empathy, the compassion, the interpersonal relation. That's why I think that technology really paradoxically almost, we would think, can augment how we connect in a humane, in a more personal way. And the third one, I think that I have to say that certainly probably robotics. I think that robotics is just going to have this explosion in every field. Is already there, but in healthcare, we've had for a couple of decades at least, just barely one platform, for general surgery I'm talking, but in medicine in general, very few providers or companies there for robotics. And now we're seeing in general surgery, other platforms out there that are, if not better, they're different, are less expensive and more inclusive and more available to billions of people in the world, not just the very few societies that can pay for a $1.5 million machine, right? And they're going to be more versatile. And if you see companies, in Europe, in the UK, in Germany, in Italy, things are really changing fast, and I think that very soon we're going to see in the U.S. market or in the Canadian market, North American market, we're just going to see many more options, and we're not just going to have to go with one company where you have options and depending on what you do, and you're really going to be able to not just use the robot just because the robot, and I want to be do this robotically, when I could do it in half the time and maybe a less expensive way, in an open fashion or in a non-robotic minimally invasive fashion. Now we're going to justify, I think, the use of the robotic device. So those are three, I think, immersive technologies like VR, AR, and mixed reality, AI algorithms, and robotics would say that be my three picks.
Very exciting, yeah. And with regards to robotics, and I guess AI and those coming together in a surgery setting, how do you see them, assisting surgeons? Do you see, using AI within robotics and machine learning to, reduce complications or errors during surgery, or do you see it more for as like, for providing more remote surgeries, where a surgeon is in one location and a patient might be in a more remote location, and assisting in that regard?
Yeah, no, I think that all of the above. I think that there's really no limit. It's only the limit is only created by our short imaginations, I think. And obviously, cost and regulation and education, culture, especially regulation probably would be the most, but in regards to telesurgery, surgery at a distance, but, that will certainly be the future, why not? I mean, it's really possible already. And if you see how we are connecting in a much better way, if you think about, how the internet is growing and how you have projects like, let's say, Starlink for once, or 5G, when 5G is coming and the bandwidth is much wider, and the speeds are like exponentially faster. So you can see already that you have surgeries. 2 years ago, in a Chinese team did robotic surgery at almost 3,000 miles away, robotically in 5G, not even on a high-speed cable, but in 5G. So that is pretty amazing. That's 2 years ago. So I think that the possibility is there. And in regards to AI improving how we do it and what we do, absolutely. I think that there are already groups out there, like you have, for example, a digital surgery, touch surgery / digital surgery from the UK. Almost 2 years ago, they already had their platform that basically can analyze with image recognition and pattern recognition, can analyze objectively the steps of the surgery, and then it can alert you if you're deviating from your norm, or can improve how you do the surgery, for example. All those are possibilities. You have in Canada, you have the black box surgical the black box project in I think it's in Toronto, that has been going on for a long time, where they are basically capturing everything, sound, images, everything, and putting back everything together and having an AI algorithm analyze it, and then help us improve our performance. I think that that is the horizon. I think that there's no reason, I think, to fear that, if we can provide a better outcome, right, for our patients. I think that and if you see how a training can be revolutionized, and is already being revolutionized by measuring biologic parameters, heart rate, blood pressure, pupillary, eye tracking, galvanic skin resistance, and see whether you're excited or you're stressed or not. Last year I did a pilot project with a company called Eye Motions, eye with an I, like the letter I, Motions, that has all those sensors that monitor your physiology, and also Vario, the company, a Finnish company that has the most advanced virtual reality headset. Now is virtual and mixed reality headset, and we were doing a surgical training procedure step by step, and I was being measured, and they would compare me with someone, a novice who was starting to learn the surgery, a younger surgeon or medical student, and you could see the differences, when you're step by step and you feel kind of easy to do and you're kind of in the zone, right? but someone who's learning might not be there, and it's maybe more tachycardic, or it's the galvanic skin resistance is different, and you can tell the person is not. So imagine an AI algorithm can then tell you, how to improve on what you do and analyze what you're doing to measure you and increase your performance. I think that those are very, very exciting fields.
Okay, yeah, great. Sky's the limit.
Yeah.
And I know that you're an advisor to a number of companies and organizations, including MagicLeap. What is your motivation to become involved as an advisor in that capacity with these companies? And do you have any advice for physicians who might be interested in pursuing such opportunities down the road?
Yeah, I think that it's very important. I love technology, and for me, it's easy, and it's really a win-win because it makes me more knowledgeable of what's happening. Many times, I can, I get prototypes or gadgets and things to try very early on, and that to me is very much fun because you can help shape the gadgets or the platforms to what you think would be ideal, right? In regards to healthcare. So I think that it's fundamental to get involved because if the people producing the software or the hardware, right, the different platforms don't have the input from people who's practicing, who's suffering, healthcare today, the frustration, the crisis that we have in healthcare, you've heard, mental health, burnout, all these issues. And I really think that a great deal of that is because the way we are approaching medicine and technology. We've been doing digital health, for almost a couple of decades, and we're doing it wrong because we're focusing on billing, we're focusing on documentation, on regulation, rather than focusing on improving the connection between the human and the human, right? And I think that we, now instead of being with the patient, 80% of the time and maybe 20% of the time doing paperwork, now it's reversed, right? Now we're 90% of the time in the computer, putting the data, and we're talking to patients and we're not even looking at them, and that is not right. I think that we need to reverse that. And if we use technology in a smart way, then, so I think that as clinicians who are really practicing day and night, and you're clinicians, so I think that is a responsibility to get involved with companies who are shaping those products. It'll be better for them because they'll be more successful, right? And also to share the message. When I did my first TEDx, I think I've done about 5 or 6 TEDx. I think that and being involved in social media is really important because it's not about getting followers. And I'm in Twitter and LinkedIn pretty often, only sharing and receiving information about technology and healthcare. And it's one of the best platforms to communicate. So if I'm not there, sharing stuff that is important in healthcare and technology convergence, maybe some other person who is not in healthcare might be doing the same and misguiding people. So I think that it's a responsibility to just be involved with companies and to also be out there, sharing the message in any platform you found.
That's very well said, Rafael, and I can't say I echo a lot of your statements and completely agree with you. I think the people that are creating these, disruptive technologies within the healthcare field, there has to be input from the providers, and creating something where, there is no input can cause more issues than good.
Yeah, agree.
Very well said. And speaking of, you going down this path of being, an innovator and, being more of a spokesman for, driving innovation in healthcare. When was your aha moment that you were going to be doing that besides solely being just a physician and just a clinician? What made you take that extra leap?
Wow, I don't think there was just the one moment, that I've always liked that electronics and technology and stuff since I was a kid, basically. And one of I did a TEDx in Bermuda. That is one of my favorites. I think that the first one with the iPod telemedicine, but the one in Bermuda tells a little bit of maybe something like this, the story behind how I I started doing this. And I was alone in the Amazon in the last year of med school, which I was like doing an internship, but before you graduate. And I was in the Amazon in the middle of nowhere for 3 months, and with no connectivity or connection to communications with anyone, and the local physician sometimes had to go away for several days or weeks, and it was on my own, and having that lack of communication, with any knowledge or any help or any experience or any expertise, just me there, maybe brought some of that passion for communicating and connecting better. But certainly when I think that when the iPhone 4 came out with FaceTime, and after years of struggling to connect the big computers, the big cameras, all those telehealth platforms that cost thousands of dollars, when I saw that we could do it all from a watch, basically, or from a little a device. I thought, wow, this is going to revolutionize how we connect and communicate. Why are we using these big computers on wheels and stuff when we can do it with that? So we set up the iPod Touch program, where I delivered iPod Touch and tablets to different critical access, small hospitals, rural hospitals, away from my bigger hospital here, and we started doing consultations that way using the Wi-Fi that they had at the hospital already, so we didn't have to pay any extra. And it was for $229 is what the iPod Touch cost back then, so it's very inexpensive. So that was one sort of aha moment. And when I saw the Google Glass in action, I thought, and people say Google Glass was a failure, but I really call it it's almost like the Model T, of head-mounted displays. We have gone from something, like this, to a device, like this, right? In virtual reality, the Oculus Quest, or a device like the, a HoloLens 2. In how many years? In no time at all. You have devices like the MagicLeap, and so you go from this to this in no time at all. So that for me was a kind of an epiphany of sorts. When I said, wow, communication is just going to be exponentially changed in ways that we won't be able to even know what to do with them, and it's true. We have so many devices, and we use them still for nothing. It's like the tip of the iceberg, very much. We have all this potential to, in healthcare especially, improve what we do and how we teach.
Yeah, and that sounds like quite an experience that you had in the Amazon. I can't imagine. As an innovator, do you ever feel like you're going against the grain of traditional medicine, and do you ever get resistance for going down that path, and how do you deal with it?
No, not at all. Of course I do. That's my every day. You have to fight against the it's like fighting against the power of the ocean. It's like Niagara Falls. You're trying to climb it. It's impossible, right? And well, it's not impossible. It is possible, but it is difficult. And I think that the message is that you need to just keep doing it. And if you believe in it, just keep doing it. And if you have to change course, just change course. And it's just like anything else in life. Sometimes the obstacles make you stronger, or the failures give you opportunities. The typical things that one hear are true. From the administration point of view, from the regulatory point of view, there's always opposition because, many reasons, right? The tradition, paradigms, the cost, the regulation, the law, but things eventually morph and change. Look at the pandemic. We were trying to do telemedicine forever, right? And barely could do it. All these reasons not to, it's too expensive, no one pays for it, no one reimburses you for this, the law, the regulations, you're going to be fined, and the privacy. And suddenly the pandemic comes, and in 1 week everyone is doing telemedicine, right? And communications for anything else, from education to sales to retail to entertainment. So sometimes it just takes a little tweak to change the modus operandi, I guess, and change the status quo. I think that that is the thought that one has to have, not to say, I can't have it anymore. At the hospital where I work, it took me almost 3 years for them to accept, Google Glass, which was already an accepted device. There's a company called Augmetics with an X at the end. They have a virtual scribe. You put the glass on when you're with the patient in the clinic, and the virtual scribe in India, who is your own scribe, who knows you and knows how you like to edit your notes in the chart. That scribe in India is in the chart. Instead of me in the computer, the scribe is listening and looking to everything I'm doing with the patient, following privacy rules, obviously. But at the end of the visit, I don't have to even look at the computer ever. I just look at the little screen if I need to. I can order stuff and I can talk to my scribe, and I cannot lose the connection between the face and the face of the patient. And at the end, you go and you look at what the scribe already populated, you sign, and you go to the next patient. So even if you don't have more time with the patient, you still have, let's say, 15 minutes with the patient, but you have quality time, quality 15 minutes, instead of 14 minutes in the computer and 1 minute really looking at their faces. So it took me 3 years for the hospital to finally say yes and engage. And it's ridiculous, because sometimes people say they're innovators, but you have to have a vision beyond the the reimbursement, beyond money, beyond. You have to have a vision of I guess be a little bit of a dreamer, but as a corporation or as a health system, I think that they must change how they view patients, because it can't be about productivity. It cannot be about money, and there are many health systems like that, right? But it has to be about the patient experience and the outcomes. But even more than the outcomes, I'd say, I dare to say, more than the outcomes is the patient experience, because if you're cured, but you were miserable in the experience, you're not cured. You got that inside you, and somehow it's gonna be harder to be cured if the experience is miserable. I think that if you have a great experience, it's like hospice. If you have a great experience dying, I think you die more peacefully. And there are ways to do that. We just need to think differently, I think.
Well, it's great to have you fighting the good fight, Rafael. There is a lot of resistance. How do you spend your time now, and what does your day-to-day look like?
Well, I live in Maine, so it's a very nice setting. It's kind of a semi-rural, and when I'm not at the hospital working, I'm with family out there hiking or outdoors, and enjoying the beauty of the state. I love to read. Spend time with the family. Really, that's most of it. I used to do a lot of sports, and with soccer and then swimming, and now it's you go hiking, you go swim in the lake. I do a lot of stand-up paddle boarding, that kind of stuff. So when I'm at the hospital, my day-to-day is really I do 2/3 of what I do is emergency surgery, acute care surgery, we call it in the U.S. And in Canada, I think too, and trauma surgery. And 1/3 of what I do is elective surgery, so bread and butter surgery, but I also do advanced laparoscopy and robotic surgery. You're on call, you got a team of partners, and we all take care of the same patients, and we have 7 physician assistants who work with 7 surgeons. So we have a pretty good team that really is trying to do their best. And when you're on call usually the 24 or more hours, and then you have day or two off afterwards. We have sometimes shorter shifts, but it's we have students who follow us around and learn, third-year med students, and sometimes family practice residents. We don't have any other residency at our hospital, but we do a lot of outreaching to other hospitals, smaller hospitals that send us trauma patients, and we review the process of sending the patients and the outcomes and what could be improved or what needs to be preached, praised to them for doing a good job. So it's really important that we do a lot of education. We do advanced trauma life support courses. We do ICU, surgical ICU. We take care of our own patients in the ICU. So it's a lot of fun. It's very diverse, and that keeps you, focused.
Right, great. And what are the next steps or the next chapters of your life? What's next for Dr. Rafael Grossmann?
Well, I was just chosen to go to SpaceX. No, I wish. Right now, I am really focusing a little bit more in the next few months. I will start doing more digital health, getting a little bit more involved with dedicated time to really explode that potential that technology has. There is a few groups that I'm working with. Level X is a gaming company that went into healthcare that was bought by BrainLab recently. I'm working with Fundamental VR. There's so many good things happening out there that I think I need some dedicated, about 10-15% of my time dedicated to just empower those companies and help them shape the platforms a little bit better. And the rest is just going to be what I'm doing now, which is my real passion. I have like two passions, I guess, but I could not stay away from patients and not operate and take care of patients. That's really what I like the most. But I will be doing more evangelize in healthcare and digital health, and try to connect with as many groups and companies and startups to help them and shape the journey and the platforms. I'm really, tell them, use me as a resource. I love to have the medical expertise, and I have this geek expertise, I guess, that sometimes people look for. So I like to connect with even more companies.
Great. Well, yeah, we're looking forward to seeing where your journey goes from here. And just to wrap up with our last question, who has had the greatest impact on your life and why? So more of a personal note.
Well, they always ask me this question, and I always say it's my father. My father's a surgeon, and it's he's now 94 years old, and he I think I'm one of 8 kids, so he never pushed me to go into medicine or even less into surgery, but I became a surgeon, and that's what I would do over and over, if I had to do it all over again. And my father, I have to say, had that spirit of caring for people, and to just loving your family, but at the same time, your patients are your family too, and you do anything for your patients. And we'll go to the beach, a 3-hour trip, and when we got to the beach, he was called to go back because one patient, and he had to go back, and then he would, and then we come back. And so that sort of dedication and it's almost like a religious experience, right? To really have your patients as the most important thing for you, and the human side of how his patients would see him as a magnanimous person, as a godly person in a way. I guess that I always say, how come people love my father so much? If you save someone's life or someone's relatives' lives, that appreciation of that gratitude feeling is something very, I think, very very, I guess, important to me. Not that I don't look for gratitude, but when you get that sort of sense of appreciation from another human being because you did something good for them, that I think that's very, very important. And we, the bedside manners, to treat patients like humans. I think that stuff is just the most the largest imprint in the way I am as a physician. It came from seeing that from him. So I have to say it was him.
Well, that's great. I'm sure he's very proud of you, and it's good that you picked up on those great attributes of his.
Thank you.
So yeah, Rafael, I wanted to thank you again for coming on and sharing your many pearls and wisdom. For those listening, we'll post an image of this, but where would you like, where can people follow what you're doing and the activities that you're up to?
Well, like I said, the best way to follow me is I'm in LinkedIn, and I always answer through there. I also have a blog that I populate with my Twitter and LinkedIn feeds, just my name .health or my name.com. My name, Rafael Grossmann, one word. And you can probably share the links with them, and also in Twitter. In Twitter, my handle is ZGJR. And I'm pretty active there. And again, I'm always sharing stuff about exponential technology in healthcare and education, and getting stuff from very interesting people. So I guess it's if you're curious about healthcare and technology convergence, it's probably going to be good content there for you. So yeah, follow me there, and or not follow, but at least look at it, because it's some good content in there that is exciting.
Great. We'll definitely post those, and thank you again, Dr. Grossmann. Appreciate it.
My pleasure, Sonny. My pleasure. You take care. Thanks.
We welcome you to join our community at physicianinnovator.com and follow us on LinkedIn and Twitter.